Hi everybody, it's Adam, and we are here at the Mitral Conclave. Very fortunate to be standing next to Dr. Marc Gillinov from the Cleveland Clinic, and we're answering your questions that were put at HeartValveSurgery.com. This question, Dr. Gillinov, comes from Sophia, and she writes, Adam, I'm 62 and diagnosed with severe regurgitation. I need surgery, and I'm scared out of my mind. Is there anything the surgeons can share to help ease my anxiety and fear?
Absolutely. It's normal to have some fear and some apprehension. Somebody tells you you need heart surgery, and most people never expect to hear those words. I would recommend a few things, having talked to many people, thousands of people with this sort of concern, which again is natural. First, gather information, but don't dive too deeply into the internet. Go to a few reputable sites like yours and get information, but don't overthink it, because the more information you get, the more contradictions you'll find, and that can cause even more anxiety. So go to the internet, get some information. Talk to someone you know, and you must know someone, you will know someone who's had heart surgery, who's had a heart issue, because that will reassure you. And then when you go to meet with your surgeon, sit down with your surgeon and do listen to what your surgeon says, what he or she tells you about what operation should you have, how should we do it. But ask questions that go beyond just the technical aspects of the surgery. Ask the questions that have answers that are going to allay your concerns. For example, people almost never ask, is this going to hurt? Or if it is going to hurt, how can you make it so it doesn't hurt very much? People rarely ask, how long till I feel normal? And there are real concrete answers to these questions. Depending on how your operation's done, your surgeon's going to be able to say, it might be 2 weeks, 3 weeks, 4 weeks, 5 weeks. Your surgeon might be able to say, we've got a great protocol in place for managing discomfort so that we will keep it under control. And probably most importantly, make sure that your doctor and your surgeon are people who are willing to talk to you, because you do want an excellent plumber. You want everything fixed on the inside, but this is not like dropping your car off to get the brakes fixed, where you don't really care if you talk too much to the mechanic. In this case, part of the whole process, part of the whole care is talking to the doctor and having your concerns addressed. So get the best plumber you can, but make sure you're getting a good person as well.
And one of the questions that a lot of people, one of the big fears is that of obviously death and mortality. And I know what I found comfort in was the actual statistics of success, not a failure, but of success. Can you share a little bit about your statistical outcomes with patients who come to you, like Sophia, who have issues with severe regurgitation and need surgery?
Well, Adam, you just made a really key point. I now always phrase the statistics in terms of success. I used to tell people, let's say you're having an isolated mitral valve operation, our operative risk, the risk of dying, is around 1 in 1,000. And when I said to somebody, your risk of not getting through is 1 in 1,000, a lot of the time they heard that wrong. They thought their chance of surviving was 1 in 1,000. And of course, you don't want anything where the chance of surviving is 1 in 1,000. So to set the record straight, the chance of surviving an isolated mitral valve operation is 999 out of 1,000. So 999 out of 1,000 people will sail through getting their mitral valves fixed. 99% of them won't have a stroke or a heart attack. So, we're talking about people who in general are in the category of the chance that you get through this and come out the other end in great shape is high 90s.
Great. Well, as always, Dr. Gillinov, thanks for your help and all of your incredible support. We really appreciate it. Again, this is Dr. Marc Gillinov from the Cleveland Clinic.